You are taking a look at some of the biggest coronavirus developments you need to know about. Right now, there are nearly 26,000 cases across the state, nearly 770 deaths. Out of those cases, we also know more than 13,500 are presumed recovered. I want to take a closer look at the number of cases in North Alabama that were added within the past 14 days. We'll start here in the metro area. Madison, Morgan, Limestone, and Lawrence counties. In the past 14 days, we've added 703 new cases. That represents 46% just about of the total cases recorded in this area of 1,542. Heading over to the Sand Mountain area, Jackson, DeKalb, Marshall counties. Last 14 days, we've seen a spike of 300 cases. The total number of cases is 1,340. Total number of cases in the Shoals across Lauderdale, Colbert, and Franklin County now at 1,244. They've added over the past 14 days 327 new cases there. Thanks for joining us tonight. I'm Dan Schaefer. Naja Sherman has the night off. I want to begin tonight by taking a closer look at this recent spike in coronavirus cases across the state. You're taking a look now at the number of new confirmed cases within the past 5 days. You can see June 12th recorded the most during that time span in Alabama with more than 1,000. In total, there were more than 4,200 new cases in the state. We want to check in now with WAAY 31's Ashley Carter. She's live after asking the health department if new regulations or closures are on the way. Ashley?
Dr. Scott Harris says as of right now, there is no plan to close down the state. He says they are advising local governments, and it's up to individuals to take the proper precautions, but closing down businesses again would just be too difficult at this point.
I think we all wish that we had started things a whole lot earlier and could have maybe lasted a whole lot longer. But, you know, reality is that all states are moving towards opening up. Alabama's no different.
Dr. Scott Harris told me it's possible public or local officials could add in additional safety measures, but shutting down the state again would be difficult.
I don't think there's a lot of public appetite for that. You know, there's this COVID fatigue that, you know, is not just in Alabama, but it's everywhere. And, you know, I think whether it's health orders or any kind of law or regulation or anything else, you know, you need the public support and the public buy-in or it just doesn't work.
Dr. Harris says it's important people take personal responsibility to keep themselves and others around them safe.
If people were able to follow those rules, we could have, you know, been out of the woods a long time ago. But, you know, I certainly understand it's hard to change people's behavior.
Mission meeting, however.
I reached out to Governor Kay Ivey for a comment, and her press secretary sent me back a statement saying that Governor Kay Ivey continues to keep in contact with Dr. Harris and monitor the situation. She says it's up to everyone to make sure that they're keeping themselves as well as others safe. The current Safer at Home order is in effect until July 3rd. Live in Huntsville, Ashley Carter, WAAY 31 News.
Thanks, Ashley. Between June 8th and the 14th, Alabama earned a title it didn't want. It saw the second highest rate of new coronavirus cases per capita in the nation. It added nearly 6,000 cases during that week. That's more than 12 new cases per 10,000 people. The only state with more during that time span was Arizona.